Hi there. Is your jaw pain keeping you from getting a good night's sleep? You finally crawl into bed, hoping for some rest, and instead you wake up sore, tight, maybe even with a headache. That's no way to start your day. It could be that your sleeping position, habits, and nighttime routine might be making your temporomandibular joint pain worse. Here's what to do instead. We'll cover the best and worst sleeping positions, talk about how conditions like obstructive sleep apnea and reflux play into TMJ, and at the very end, I'll show you a calming bedtime technique that has helped dozens of my patients get that restful, healing night's sleep that they've been searching for. So make sure to stick around for that. Let's be honest, sleep is when our body does its repair work. Muscles relax, tissues rebuild, and ideally, our nervous system gets a chance to rest. But if you're sleeping in a position that puts strain on your jaw or neck, or you're clenching and grinding throughout the night, that rest turns into more stress. What we do during those 6 to 8 hours we sleep has a huge impact on jaw function, neck pain, headaches, and how we feel in the morning. And it's not just about TMJ joint, it's about breathing, posture, and your nervous system. So the real question is, how do you set yourself up for success while you sleep? Let's start with the one position that's universally terrible for your temporomandibular joint, sleeping on your stomach. When you sleep face down, your neck has to rotate to one side so you can breathe. That twisted neck position pulls on your jaw. Plus, your face is pressed into the pillow, often putting pressure on the mandible and compressing your temporomandibular joint, or TMJ. Over time, this can cause uneven joint wear, muscle strain, stretching of the ligaments and joint capsules, morning pain and tightness in the jaw and neck, and an increased tendency to clench. Think about it. If you're always turning your head to the same side, you create imbalances in the joints and tissues. That asymmetry can feed right into your TMJ dysfunction. Also, as we get older, our spine loses flexibility. So even if stomach sleeping used to feel fine, it may not be working for you anymore. Bottom line, if you're still sleeping on your stomach, now is the time to try something else. You're not a baby anymore. Let's talk about back sleeping, often considered the best position for spinal alignment and jaw neutrality. When done right, back sleeping allows your head and jaw to stay centered, your neck muscles to relax, your body to stay aligned without pressure. You can enhance this position with a supportive pillow that supports your neck more than just your head. A rolled towel under your neck for a gentle extension, like CPR head tilt if you've ever had to do CPR. A pillow under your knees to reduce lower back strain. But, and this is important, if you snore, grind, or have obstructive sleep apnea, back sleeping may be the worst for you. Here's what happens in obstructive sleep apnea, or OSA for short. When you're lying on your back, gravity can pull the tongue and soft palate tissues backwards. This narrows the airway, making it hard to breathe. Now, your body is smart. It will recruit your jaw muscles to help you breathe more easily. Your brain essentially says, move that jaw forward so we can get more air. Or maybe it's, move that jaw forward so we'll get more air. That's why so many people with sleep apnea also clench and grind their teeth at night. It's a survival reflex. Your body's trying to get oxygen. But over time, this forward jaw clenching muscle habit leads to TMJ tension, muscle fatigue, inflammation and irritation in the joint, poor quality sleep, and anxiety. To top it off, less oxygen equals more stress, equals fight or flight mode, equals even more clenching. It's a vicious cycle. So if you have OSA or suspect it, talk to your doctor. You might need an oral appliance, a CPAP, or other treatment because jaw health and airway health are deeply connected. If you're a therapist wanting to learn more about helping people with TMJ problems, take my Simply TMJ webinar. The link is in the description. So what about side sleeping? For a lot of people, it's a great option, especially if you use a supportive pillow to stay mindful of jaw positioning. But here's the thing. Don't sleep with your hands under your face or jaw. That extra sideways pressure can push your jaw out of alignment and irritate the joint. And here's another factor, GERD or reflux. If that's part of your health picture, sleeping on your left side is better than your right. It helps the stomach content stay put and reduces nighttime heartburn, which can also disrupt your sleep and increase tension. A few tips for good side sleeping. Use a pillow that fits the space between your ear and your shoulder. It needs to be thick enough. Hug a body pillow to keep your top shoulder and arm supported. This can help prevent your shoulders from rounding. Place a pillow between your knees to keep your hips aligned. Oh, and if you see a NUCA chiropractor or have upper cervical issues, side sleeping might not be the best for you. Back sleeping with support is likely better. So how can we get our bodies into the ideal sleeping posture for us? Let's look at tools that can support better sleep for your jaw. Mattress firmness. Medium towards firm is usually best. Enough support without pressure points. Avoid the built-in pillow tops as they just tend to compress rapidly. Add a topper instead. To choose a topper, I like latex. I think it's the best. But memory foam is good too and can add comfort if your mattress is too firm. Night guards or airway appliances. Custom-made oral appliances can reduce clenching and protect your joints and teeth. I prefer a mandibular or a bottom mouth guard. Avoid cold air. Don't sleep directly under a fan or open window. Cold air on the neck can lead to muscle tightness and guarding. Need help staying on your back or side? Try placing rolled up towels or small pillows or even plushies at your sides to prevent you from rolling over in your sleep. Or do what one patient does and have 5 cats sleep with you, one under each arm and the others between your knees and beside your knees. If you move, whoosh, they just swat you. Okay, here's that calming ritual I mentioned earlier. Step 1, a warm compress. Apply a moist heat pack or warm towel over your jaw and temples for about 20 minutes aside before bed. This helps increase circulation, soften tense tissues, and ease soreness. Step 2, gentle breathing. Once you're in bed, do this. Inhale through your nose for a count of 4. Exhale slowly through your mouth, counting to 6. Do this for 5 rounds or 5 cycles. This turns off the fight or flight system and helps your nervous system shift into rest and digest. Want a guided version of my 4x4 breathing? Check out my breathing video for stress and anxiety. It's linked at the top corner and in the description. Sleep isn't just rest, it's treatment. If this video helped, check out my guided breathing video and don't forget to like, subscribe, and let me know in the comments, what is your current sleeping position? And are you thinking of switching it up now? See you in the next one. Sleep well and take care of that jaw.